Okay, so as adults, you will be facing many new decisions in your life compared to your teenage years. Of course, teenagers, they have the same temptations as adults, but it's on a totally different level because you're not actually dependent on anyone to, guide you through. You're on your own when you get to the real world. And understanding what can put you at risk for disease is very, very important once you're outside of your parents' household. This information is not meant to scare you. It's just knowledgeable and something that you could pass on to other people, as time goes by. Who can tell me what the letters HIV and AIDS each stand for? Did you know that?
Do I know that? Autoimmune deficiency and HIV. I know.
Yeah, it was tough for me. It was tough for me as well. But this is what it means. HIV means human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. Now, what does each of these mean? HIV can harm you because it attacks your body's immune system. I have a true or false question. A low immune system can allow opportunistic infections to invade your body.
True.
That is true. AIDS is a stage of disease where your immune cells, basically your T, CD4, and helper cells, drop below the level of 200 cells per millimeter of blood. A healthy person has about 800, so the blood goes way down. And your body cannot fight off the simple infections. Medications today can help people with both HIV and AIDS live much longer than they used to. The origin of HIV likely resulted from hybridization, merging of two simian viruses, basically two monkeys. From what I researched, they say it started in monkeys, and my biggest thing was trying to figure out how did it get to humans. And I still don't have a clue. So many different answers, from humans having sex with monkeys, which is odd and creepy, but that's what they say. It started in Africa, and I do know how Africa is. I don't know how it happened, but it moved to humans in Africa around 1930 or earlier, and it started to spread from there. And this just shows basically around the world the adults and children living with HIV/AIDS. As you can see, the majority of them are right in Africa, 28.5 million, which is a lot of people. So total about 40 plus million around the world that have HIV and AIDS. There are over 56,000 new infections every year in the U.S., which is scary when you think about it. Most infections are found in people ages 13 to 29, which is around the age when a lot of sex is going on all over the place, which is the main reason how it spreads between the sex and drugs. True or false, most cases of HIV infection in Texas occur in older people ages 40 to 49.
False.
You are correct, that is false. 41% of the cases of HIV infection in Texas occurred in ages 20 to 29, as if I just said. And 50% of AIDS cases are in this age group. This just shows basically a cell. It was hard for me to really break it down, but I found a cool picture that looked, basically it's showing how AIDS is attacking the inside of you. I just wanted to put a cool picture up. And these are ways to transmit HIV. It will be by bodily fluids, any type of unprotected sexual activity. Internet chat rooms have become a place where people are meeting, and this is leading to HIV transmissions.
How?
Just the people that, for instance, a guy has HIV. This is his way of targeting people and having sex with them and passing that disease on. So it's
As a meeting place? Is that,
Yeah, this is where they're started. They're not engaging person to person. They're more comfortable chatting with you on a social network of some sort, from Facebook to any type of chat room, and it's really disgusting. They're basically prowling on people and infecting them. I actually have a personal friend of mine who has not AIDS but STD. He has herpes. And he still goes out and engages with other women, which is very sickening. Like knowing that you have that problem. Needle sharing, of course, that goes from drugs to anything else. Needle sticks or exposure to blood. Mother to child, which comes from breastfeeding. They say, from what I was reading, it seemed kind of weird because babies usually, even if the mother has it, sometimes the baby won't have it until they get breast milk from it. So they could come from the mother and not have HIV until the milk situation. And blood transfusions prior to testing in 1985. So before 1985, they didn't actually test the blood that they were giving to other people, which resulted in those others being sick as well. Okay, now that you know how you can get HIV, how do you think you could prevent it? Give me some ideas, or maybe some things you think to prevent it?
protected sex.
Using some condoms, right? Of some sort. Anything else you could think of?
Wear gloves when you help somebody that you may or may not know, if they were bleeding and you may or may not know they have a disease.
Right, you don't want that to have an open sore and touch you. So those were some good answers. If you knew someone who was HIV positive, you could get HIV from coming into contact with their sweat, urine, or tears. Is this true or false?
False.
That's correct. 100% to that. The only bodily fluids that can transmit HIV are blood, semen, vaginal fluid, or breast milk. Other bodily fluids, only if there was blood present or visible would you get, exposed to the virus. So don't be afraid to kiss, hug, or share food with someone who has HIV, although I still don't. Who can be affected by HIV?
Anyone.
Anyone. If they engage in unprotected sex or share drug use equipment, any age, any gender, anyone. People close to them are also affected by this disease. That's just mentally. This just shows some pictures of different people that have the virus. Kids, this is at like a children's hospital, and they're all together. They keep them together. But it's pretty saddening. Just showing AIDS awareness. These are some symptoms and important information. The symptoms present days to weeks. They're present days to weeks after initial exposure. So it may not come immediately over time for some people. It's months, sometimes a year for some people even realize that they have this disease. Most common presentation is fever, fatigue, headache, and rash. So those are some of the things that people get to notice over time. The HIV window period, this is the time it takes for the virus to actually show up in your body after exposure. This could take up to 3 months. Who could tell me why this would even be important to know?
Because then you wouldn't be able to test right away. You may have to wait. One test immediately after concern
Right.
may not provide all the information.
Right. So that's a good answer. It's important because the sooner someone knows that they have HIV, the sooner they can receive the proper medical care. It is less likely that this virus will be transmitted to others if it is known. So that helps you to, stop whatever you were doing and hold on a second there. How can someone get tested for HIV? Texas law allows 14 years and older to obtain an STD test without parental permission, which I didn't even know. I thought, I always assumed 18 for everything, but they don't encourage children to go without their parents, but they are able to do so. in those cases where they're out on their own or, you know, whatever the case may be. Conventional blood test, you get results in 10 days or 10 business days, which is about 2 weeks. Or you can get a rapid test, which they say these aren't as accurate, but you can get the results in 12 to 20 minutes. But
Are those available over the counter or are those through a physician?
you would have to go through a clinic of some sort. There's no over the counter for it. Just because one time they did say that they had something about over the counter, but they weren't really accurate. Kind of like when people do like different home drug tests and things like that. It's just, you never know. And the summary of how does HIV spread through sexual activity and injection drug use, bodily fluids that can transmit HIV or blood, semen, vaginal fluid, and breast milk. Be informed and educate others. And this is just people making a ribbon. I also brought a condom quiz. It also has the answers as well on the next page, but you know, try to give it a shot, just some true or false things. But other than that, were there any questions that you had for me?
Is there a decline in how many cases are being transmitted? Is there a sense of getting a handle on education for people?
Yeah, I do know that there are a lot of more, as far as, I know there are a lot more advocates out there that are going, starting with the younger kids, of course, but going to the high schools, and they say that it's going down a little bit, because that 56,000 that I showed you every year, what I saw last year's numbers, well, it was 10 years ago from last year, the numbers were like twice that. So, but they said ever since they've started going to schools every year, so the kids in high school are hearing this 4 years in a row, is what I'm seeing, that they go every single year and you have to attend it as part of the physical education total program. So the numbers are going down on that end. As far as adults, that's why I kind of did this one, because adults are on their own. They don't really have anyone to keep reminding them. You know, everyone knows it's around, but you're not careful at times. So, yeah.
And are condoms truly 100% effective at preventing it?
No. And it's stated on the package as well, but they do, I think they give about a 90, I think it was like 93% chance of, preventing the virus or the transmission of the disease. So it's not all the way accurate. Nothing is, I guess. Stay with your one partner. That's the best thing. You got any more questions?
No, thank you.
Hello.